Joining us in the Government of Newfoundland and Labrador Media Centre today are Premier Ed Fury, the Honourable John Hagee, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
CD stopped.
Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador's COVID-19 briefing for today, Wednesday, October 21st. And to Dr. Fitzgerald and Minister Haggie for their continued dedication to keeping the public informed throughout Newfoundland and Labrador's fight against COVID-19. First, I'll turn it over to Dr. Fitzgerald for an update.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us today. Since the media advisory yesterday, we have no new cases of COVID-19 in the province, and the total number of cases remains at 287. 274 people have now recovered, and in total, we've tested 49,502 people. We continue to monitor the epidemiology of COVID-19 across Canada, and what we're seeing is that many Canadian provinces have now entered or are beginning to enter the second wave of COVID-19. Even with our public health measures and travel restrictions, we knew that we would start to see new cases because of the situation across Canada. And it remains incredibly important to stay vigilant given the epidemiology of the rest of the country and the risk that it poses. As expected, over the last week, this has started to happen, and our new cases have been related to travel or limited to close contacts of affected travelers. And we have been extremely fortunate to have had low numbers of cases since the summer. We have been very diligent as a collective in responding to the pressures and uncertainty associated with COVID-19. In public health, we have many levers and tools to use in stopping the spread of COVID-19, and I've spoken many times about the importance of contact tracing and the role it plays to protect the health of the population. Because of our unique situation, our goal continues to be containment of the virus to prevent spread within our communities. We need people to feel safe to come forward for testing if they begin to experience symptoms. If they do not feel safe, they may not come forward for testing. If they feel they will be stigmatized or their privacy jeopardized, they may not come forward for testing. We need the public to work with us in order to protect the health of the public. So I once again ask everyone to be kind to individuals who test positive for COVID-19. With so much information out there about the virus, it can be a very difficult diagnosis to receive. You may be doing all the right things, but there is still a risk that you can get this virus. We need to support these individuals because it is the right thing to do. The quicker we know about cases and can do contact tracing, the more success we will have to contain the virus. These sacrifices that we have all made are working, so let's continue to work together. Another way we can work together is by getting the flu shot. We all want to keep ourselves and our families healthy, and getting the flu shot is another way to protect yourself and others during these challenging times. I'm happy to say that our influenza vaccination clinics in the regional health authorities begin today. Our goal from a public health perspective is to prevent influenza infections, to keep our population healthy, and maintain capacity within our healthcare system. We have seen from other countries the challenges with an overwhelmed healthcare system. By keeping people healthy and safe, we can avoid visits to the emergency departments or admissions to hospital due to respiratory infections. This year, we have many options for people to get the flu shot. All residents of the province will be able to get a flu shot at no cost. They will be available from family physicians and pharmacists, as well as regional health authorities who will be holding clinics. These clinics will follow the public health guidelines to ensure everyone's safety. We are offering the high-dose flu shot to those over 65 in our long-term care and personal care homes. These residents are our most vulnerable population and those most at risk for COVID-19 outbreaks. For the general public, including those 65 and older, we have an ample flu vaccine available. It is effective. It covers 4 influenza strains, and it offers the protection our population needs. We have set an ambitious goal of 85% vaccination rate. The higher our vaccination rate, the more protected we will be as a population. I know that Newfoundlanders and Labradorians understand the importance of taking care of one another, and I believe you will all do your part in helping us to achieve this goal. This week, October 19th to the 23rd, marks National Infection Prevention and Control Week in Canada. You'll often hear me and others in public health refer to infection prevention and control as IPAC. I would like to take a moment to recognize the important work our local IPAC teams do in this province to keep us all healthy and safe. In our province, these professionals work in our Department of Health and Community Services and in each of the regional health authorities as an IPAC team. They are all registered nurses and have further education in infection prevention and control. This year, we have seen the IPAC role come to life in ways many people were likely not familiar with prior to the pandemic. And IPAC has played an important role in the COVID-19 pandemic response. They have led the development of many guidelines and supported all government departments in their preparation and response to the pandemic. So thank you for all that you do. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in our province remains at 287. We've been here before, and we have done what was required, and with everyone's help, we can minimize the impact this virus has on our province. So let's hang in there and keep at it, and please remember to get your flu shot. Thank you.
Thank you, Dr. Fitzgerald. I recognize that anxieties are rising. While numbers here in this province remain low, we're seeing them increase dramatically in some provinces across the country. We know that a second wave will hit Newfoundland and Labrador as well, and now is not a time to let our guard down. Here at home, we have seen just a few new cases develop in recent weeks through travel. Now, hundreds of Newfoundlanders and Labradorians travel throughout Canada each week. Many of them are rotational workers who have to go elsewhere for their livelihoods to support themselves and their families. We recognize the stress this must cause to you and your loved ones, that it may feel frightening. If this is taking a toll on your physical or mental health, please do not hesitate to reach out. You're not alone. Life with COVID-19 is hard, so we must all do whatever we can to safely support each other, as many of you have been doing for so long. To all the residents of Newfoundland and Labrador, thank you for your patience and your perseverance throughout all of this. Our government is listening to you and your families. It's a challenge, and there are the restrictions you adhere to in order to protect people of this province from COVID-19 spread is not easy. Thank you for your diligence. We continue to enjoy a lack of community transmission because of you. Your strength and self-sacrifice, in fact, the strength and sacrifice of your families as well, are what's helping to keep Newfoundlanders and Labradorians safe. And Newfoundland and Labrador, may I just say, you're all doing a great job. Life for many of us has a sense of new normal, that is, living with COVID-19. Students are going to school. Children and adults of all ages are taking part in recreational activities. Our government has helped open the Aquarina here in St. John's, and we will try to ensure that Marble Mountain is open this winter in Steadybrook. Halloween is not canceled for us. My children are already making their costumes, and my wife Allison and I are happy to see the joy on their faces, as I'm sure many other parents are as well. Everywhere we go as a family, I'm very proud to see people who are following the mandatory masking rules. You are respecting the evidence-based decisions made by Dr. Fitzgerald and her team, and I commend you all. Unfortunately, we all know people in other parts of the country don't enjoy the same situation we do here in Newfoundland and Labrador. Even our neighbors in New Brunswick have seen a rise in the number of COVID-19 cases. On Monday, Saskatchewan reported its highest ever single-day increase, and Canada topped the 200,000 cases of COVID-19 mark. Friends and family in Ontario, Quebec, and other parts of the country are living very differently than we are here in order to work against spreading the coronavirus in their communities. It's why we must remain so vigilant. So you have questions, we all do. You want to know if things are going to change here, if your loved ones can come home for Christmas, and what the future may look like. You want certainty. So do I. I feel that anxiety. My family feels it. All of us here at the table feel it. The truth is, Christmas is going to look a little different this year, no matter what happens. And to amplify Dr. Fitzgerald's phrase, please hold fast. She and her team are in constant contact with their colleagues across the country, informed by the latest information from the World Health Organization. As Dr. Fitzgerald has said, at this point, It's too early to say what changes might come. The Atlantic bubble is working as it is, and Christmas may feel like it's coming tomorrow, but in COVID-19 time, that's a long ways away. The 14-day self-isolation period for travels from outside the Atlantic bubble has served Newfoundland and Labrador well, and we expect it will continue to do so. I must ask you all to be patient, to appreciate the effectiveness of the measures in place. We cannot say with certainty how long it will last. That leads me to my most significant message, echoing Dr. Fitzgerald today. Please get your flu shot. Minister Haggie and Dr. Fitzgerald and I really cannot stress the importance of this enough. Protecting against influenza will help keep our healthcare system ready to handle whatever might come in terms of COVID-19. In the most recent flu season, 2019 to 2020, 9 people died from influenza. 17 people were admitted to the ICU, and 92 were hospitalized. Influenza affected far more people in Newfoundland and Labrador to date than COVID-19 has to date. But that's thanks to your strong public health measures and following the advice of public health officials, like wearing a mask in public. The flu shot is about protecting others even more than it is about protecting yourself. You are showing incredible compassion and resilience through this global health pandemic. Let's extend that to how we think about the flu. My wife Alice and I will be getting our flu shots along with our whole family, and I urge other families and individuals across the province to do the same. I hope that you feel proud, Newfoundland and Labrador, about how we've responded to date. We're doing well, but now is certainly not the time to be less vigilant. Let us continue working together to protect each other through these trying times. Thank you. I'd like to now turn it over to Minister Haggie.
Thank you very much, Premier. Today is day 228. Before I make my remarks around some health-related issues, I'd just like to comment on the passing of another pillar of the medical community in Newfoundland and Labrador, Dr. Albert Davis. He was a pediatrician, had a lengthy connection, probably about half a century, with the Janeway Hospital. He was a renowned medical educator, well respected, and he was a pioneer in some of the newer approaches to physician evaluation. I'd just like to take a moment to send our condolences to him and his family on his recent passing, and wish them well. As I say, it's day 228. We have 0 new cases. We have 2 recoveries. And you have done well, Newfoundland and Labrador. In terms of the immediate priorities for our department now, as well as continued monitoring of the COVID-19 situation here and around Canada, the flu shot campaign is underway and has started. I'm not going to repeat some of the messages from the Premier and from Dr. Fitzgerald. We have tried to make it as straightforward as possible during the COVID era, and because of that, we're running really an appointments-based system through the public health approach to vaccination. This has been very successful over the years in terms of building year on year and increasing the numbers, but our ambitious goal for this year is 85% of the population. That is what public health say we need in terms of immunity to guarantee herd immunity and protect everyone from the effects that the Premier described in previous years. We have bought sufficient vaccine to give all 85% of their vaccination this year. There should not be a supply issue at all. We have a website up where you can go and self-register with your MCP number. You can register on behalf of dependents and members of your family group and pick a time, an appointment at a location that suits you. These locations will change over the course of the vaccination campaign, and what you see now will not necessarily be the same locations in maybe a month's time. You will get advance notice through that website of changes to locations as they roll out through each of the regional health authorities. Timefortheshot.ca is where to go. For those people who have some difficulties with internet or challenges using that, there is also a toll-free number, and that is accessible through any of the regional health authorities' web pages. And I would encourage you to use, wherever possible, the website. We had 14,000 people registered as of first thing this morning, and the site has really only been publicised for just over 24 hours. So that's very optimistic, and we look forward to continuing to see those numbers. In the spirit of trying to broaden access to vaccines, it's now available through pharmacists. As private businesses, they may have their own arrangements in terms of how to book or whether they will take walk-ins, and I would encourage you to check with them before you visit. They can be done by appointment through physicians' offices, and some physicians' offices may yet decide to offer drop-in clinics as well, and I would encourage you to keep in touch with your regular primary care provider in relation to that. We are using non-traditional vaccinators, so we're looking at primary care and advanced care paramedics, licensed practical nurses to add to our manpower pool. We have, recognizing it's Small Business Week, we have a business grant for medium-sized businesses. So if you're a business with 100 or more employees, you can have access to the vaccine for free and supplies and PPE for free. If you have a healthcare professional on your staff, then we would look to you to redeploy those individuals to administer that vaccine to your employees. If you are a business that does not have a healthcare provider who's able to provide vaccinations, there is a grant, an hourly grant, which we will give on application to cover employment costs, as well as I say, providing PPE, vaccine and supplies at no cost to the business. So again, something new and innovative to try and broaden access to hit our 85% target. It is ambitious. In H1N1, we never really got past the high 60s percent, and that was the last time we saw those kind of numbers. But I do believe there is a real interest and a real desire to protect yourselves from maybe the double whammy of COVID and influenza at the same time. One of the challenges in maintaining our low numbers is COVID fatigue, pandemic fatigue. And the worry is always around how diligent people will be with quarantine, and breaches of that are a concern to us. I would encourage you that the rules are there for a reason. It is sound public health, and your best screening test for COVID is isolation, as recommended by public health, depending on the category you fall in. It is a marathon, COVID-19. It is not a sprint. And I would encourage all of you to take a deep breath and realize that some modification to our lifestyle is going to be necessary. Our goal is not 0 cases. We're not waiting for a vaccine. This is life with COVID-19. Those goals of a vaccine are coming. We don't know exactly when they are. One of the educational things from our point of view will be to see how this new approach to our flu vaccine program can inform a COVID vaccination program for when that vaccine should become available. So quarantine is crucial. It is difficult. It is stressful. And we have mental health supports available through Bridge the Gap, the 2ps.ca. And Doorways is available. I would encourage you, if you feel the need, to reach out, because as the Premier said, you don't need to be alone, even if you might feel that way. So in the meantime, I would go back to Dr. Fitzgerald's other mantra of people, space, time, and place. Those are the checklists you can use to assess you and your family's risk for any activity you may like to participate in. So again, to paraphrase Dr. Fitzgerald, hold the line, hold fast, Newfoundland and Labrador. It is a long haul, but we've been famous as a province for sticking things out when others have given in. So with that, Premier, I'd turn it back to you.
Thank you, Minister Haggie. We now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 4 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. If time permits, there will be an opportunity for further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Dr. Fitzgerald, last week you talked about the pilot project for rotational workers and the review that was ongoing there. Just wondering where we stand with that and when we can expect an update on the program.
So, yes, the information is being compiled and evaluated. So I'm hoping we'll have some information fairly soon, but I don't have an actual date to give you at this point, Kellyanne.
Thank you. And we know Halloween is around the corner, and it's not canceled in Newfoundland and Labrador, and I'm sure there's many, many happy people over this. But I'm just wondering if you can give us some of the highlights for you in terms of what's most important to follow in terms of COVID protocols with Halloween.
So we do have Halloween advice on our website, and I certainly would encourage anyone to have a look there, just to go through some of the recommendations that we have. Certainly, if you can, as a person who's giving out treats, the most important thing, of course, if you are unwell, please do not give out treats. Just somehow indicate to skip your house and to pass your treats on to somebody else who's not ill, perhaps to pass out for you. But we really would recommend that people who are not feeling well not to hand out treats. And of course, if you're trick-or-treating, again, if you're not feeling well, you should not be out trick-or-treating. And if you are doing treats, try to get them done up the day before. Maybe do them in little bags so you have less, there's less handling of them when you go to pass them out. And for parents, especially of smaller children, to accompany your kids to make sure that they maintain physical distancing, that you're staying within your bubbles and not sort of crowding at the doors and things like that, all in an attempt to try to maintain physical distancing as much as possible.
Thank you.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you. Dr. Haggie, you've said now over the last couple of weeks that the province has bought enough vaccine for the full 85%. We heard from a pharmacy this morning telling us that their supplies of the flu shot are already starting to dwindle and they're getting pretty low. I was just wondering, what is the protocol for government for restocking those giving out the flu shots, and what sort of wait times are they looking at to get new supplies in?
There is a just-in-time supply system. It's done through the regional health authorities. One of the issues originally was whether or not we had existing refrigerator space to actually store such a large quantity of vaccine, because normally we order in 2 tranches, and those tranches are significantly smaller to minimize wastage, quite frankly. We always have the option of buying more. There are contacts with the regional health authorities, and those can be accessed by the pharmacists to advise that they need restocking.
And still on the topic of flu shots, we've heard from some families who say that when they're booking their appointments, they can't get appointments for their whole family at the same time. So I was just wondering, what's the rationale behind not allowing members of the same household or family in for the same appointment to get their shot?
The appointments are given out on the basis that so much time and space is allocated for each individual vaccination. So what I would suggest is that families need to look at those clinics and those times that have sufficient adjacent appointments to accommodate the number. So if it's a family of 4, you need 4 consecutive slots, and there is an ability for each of those slots to be booked either for yourself as an adult or on behalf of a dependent. At the bottom, I just also draw your attention to the fact there is a free text box or a box there you can indicate if you have a dependent who has some health challenges or mobility challenges, certainly to advise that person will be coming at an appointment adjacent to yours, and there may need to be a little bit of adaptation in terms of time and space to allow, say, someone in a wheelchair to get their flu vaccine.
Thank you.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Sorry about that. My mute button is acting up. I just wanted to go back to the rotational worker situation, and I'm wondering if, Dr. Fitzgerald, you see any possibility of loosening restrictions even further, or applying those same measures to another segment of the population.
So part of the evaluation that we'll be looking at is, related to the measures that we have in place. So I certainly wouldn't want to make any predictions at this point without sort of seeing that first. But, those are things that we're looking at for sure.
Okay. I wanted to ask about positive tests for people who come back here, say a worker gets a positive test. They're very mild symptoms. They're self-isolating. And there's a case apparently where someone has not needed a second test before leaving self-isolation, which is causing some consternation with others in the community. Is there a hard and fast rule that you have to test negative?
No, absolutely not.
In order to be...
No? Sorry, Peter. No, in fact, our definition of recovery is 10 days from the onset of symptoms. Provided your symptoms are resolved, then you are considered recovered from COVID, and you do not require a negative test to confirm that. Initially, back in the beginning, we were asking that people would have negative tests to confirm recovery from COVID, but we haven't been doing that for quite some time now, and neither really has anybody across the country. So it's quite standard that people are considered recovered 10 days from the onset of their symptoms, provided that their symptoms are now resolved and without a second test.
Okay.
Our next questions are from Meg Roberts of CBC News. Please go ahead.
This is a question from a woman that CBC has spoken to. Her husband's a rotational worker. He spends 2 weeks in BC and then is home for 1 week, which she has to obviously self-isolate. But she says her and her daughter, who live in the same house, they're free to come and go, and she can't understand how that makes sense. And she says these restrictions don't take into account the negative effects they're having on people's mental health. Obviously, her husband has not been outside of the house or work since March. She says she wants to know why you don't have more emphasis on mental health and why we don't immediately test rotational workers coming back into the province as they do in PEI, so that they can, live some semblance of a normal life when they're home.
So those are all very good questions, and certainly we have considered the mental health of these workers, and that is part of the reason why we're doing what we're doing now with the pilot project, and why we did loosen some of the restrictions, the quarantine restrictions that we had in place for rotational workers over the summer. There are those are all things that we are thinking about, and we recognize that we have to think about going forward. Once we see the results of this pilot project, and we can evaluate where we need to or what would be a good way going forward, then we'll certainly have more information on that.
Thank you. And Minister Haggie, I know you were pushing the federal government for rapid COVID tests, especially for some of our northern communities. I was just wondering what the status on that was.
Yes, we have been told we will get them. The exact number is up for debate. It's somewhere between 24 and 28, as far as I gather from discussions, although that may be finalised a little bit higher. These are to be used for outbreaks, and they will come with 1,000 cartridges per box. That's my understanding of the situation at the moment. There will be a short period where they'll need to be validated. That's the information I have at the moment. The discussion at present is around what level of staff training will be needed to use these, whether or not they are true point of care where any healthcare provider could administer the test, or whether they are best administered by someone who has a lab training background. That will hopefully be clarified in the not too distant future. We don't expect to have the machines in the province yet for another week or two.
You must be pleased.
Oh, delighted.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm wondering on outbreak classifications. We've seen the public health releases coming about some of the camps out west, and they're coming from the Public Health Agency of Canada. But some of these sites themselves, their operations aren't discussing what those outbreaks are. Just looking to see if our clarification of an outbreak is the same across the country.
Sorry, Kellyanne, if the classification of an outbreak. So an outbreak is defined, it can be defined a little bit differently depending on where you are and in the country. It also, and you know, an outbreak in a long-term care facility may have a different definition than an outbreak in a work camp. And that may be different than an outbreak in a school. So, so there's no one definition, I guess, that we would give for outbreak per se, if you're thinking about, you know, a certain number. What we know is that certainly if we see transmission within a camp, from person to person within a camp, that generally gets classified as an outbreak, and then usually there is an process in place where the Public Health Agency of Canada gets notified, and then we get notified about such outbreaks.
Thank you. And Premier Ferry, you alluded to the second wave, knowing it's coming to the province, that we're likely to see it. Obviously, I know I'm asking you to essentially look into a crystal ball here, but with the restrictions we have in place, do we have any indication of what a second wave could look like? Do we think we'll see the numbers that we saw in March, or are we going to see small blimps of cases, kind of like we have over the last little while here?
That's a great question, and I wish I had a crystal ball to be able to even assign probabilities to either scenario. But I mean, it's two scenarios you describe could occur. And we're looking at receiving some more modeling in the not too distant future surrounding both and assigning probabilities to both. But right now it's difficult to fully predict, as you can imagine and the viewers at home can imagine, which scenario is the most likely. What I will say is that the public health measures that Dr. Fitzgerald and her team have put in place will help protect us from either scenario. And to build on what Minister Haggie was saying, you know, we all get a little comfortable as this becomes more normal, but it's important to remind ourselves over and over again that complacency is our biggest threat when it comes to any outbreak, whether it be a second wave or a series of waves in the future.
Thank you.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you, and I'm going to kind of hop off the back of Kellyanne's question there. We've seen a few cases over the past couple of weeks that were related to travel, and Dr. Fitzgerald, you mentioned that many other provinces are in or beginning their second wave. What criteria do you have that you would need to see to consider Newfoundland and Labrador in a second wave?
Well, certainly we'd have to see many more cases than what we're seeing right now. And if we would have to see those cases rising over a period of time, and that we would see likely community transmission, you know, where we have cases where we can't find the source. So at this moment, that's not where we are. And, you know, if we were heading towards a second wave, I assure you that I would be the first one out here out here as quickly as possible to indicate that, but that's not where we are at the moment. However, as everyone has said here today, we cannot get complacent. This virus is out there. It is rising in other areas in the country. Our biggest threat is importation, and so we have to be diligent with our quarantine and prevention measures, and we have it within ourselves. We have the ability to keep this outbreak a slow burn here. If people follow the quarantine rules, and stay in quarantine for 14 days after they arrive to the province. We can keep this as it has been. However, we do have to be aware that sometimes people are not able to follow quarantine, and that may be for a number of reasons, and we have to be cognizant of that. And so there is always that threat that we can have a case that, unbeknownst to somebody, that they're spreading. So we do still have to be very cautious with regard to our public health measures.
Thank you. And we saw the institution of the mandatory masks in indoor spaces as a preventative measure in preparation for a second wave back in August. And we've heard of the increased concern now as winter and colder weather approaches, of people spending more time inside. I was just wondering, could we see a tightening of other restrictions out of an abundance of caution like we saw in August?
So at the moment, we don't have an intention to do that, but obviously we'll be watching the epidemiology across the country. We'll be watching our own epidemiology, and that will inform our decisions as well as any new evidence that comes out. But as I said, we have it within our abilities to prevent the spread of COVID-19. And if you remember, people, space, time, place, even if you're doing things inside, you can still limit the number of people that you have in your gatherings at home. You can reduce the amount of time that you spend at those gatherings. You can make sure that people have the space to be able to physically distance when they're at your house, so that bubbles can be maintained to the greatest extent possible. And, even though it's getting colder, we can still go outdoors and we can do things outdoors. So we're a pretty hardy bunch. So I think the weather doesn't need to stop us. So we do still need to remember all of those important control measures that we have for COVID-19.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Thank you. I just mentioned the case of someone who the community was concerned that they didn't have a second test. And I also get a lot of questions from people who are wondering, if children of rotational workers, if that worker is not symptomatic, can they go to school? If they is symptomatic, what can they do? What about daycare? There are a lot of businesses and communities and schools, parents and business people who are just really seem to be confused about what family members can do in this sort of. Is there any possibility that a summary of what families, et cetera, can do can go up on the website to answer these sorts of questions, because they seem to happen a lot, and I don't see a lot mentioned on the website. Okay,
so there are Q&As for rotational workers as well as for families, and if people are worried about schools and about daycares, those questions are addressed there. But certainly family members of rotational workers are allowed to attend school. They're allowed to be out in public, and they are not required to quarantine with the rotational worker, provided they're coming from Canada.
Yeah, but even if they come back from, say, a hot spot like Alberta.
Yeah, at this time, that is still the guidance.
Okay, that was a mid question, not a follow-up, I hope. And the other thing I wanted to ask was, there are studies underway establishing the pandemic measures in long-term care and the amount of mortality it led to in accelerating dementia, physical deterioration, and even lack of medical care. Is there anything the province would do differently or look at doing differently in the lockdown?
I'm not sure whether that would be one for me or not. Certainly the well-being of seniors in long-term care is and has been and continues to be a real priority. We do know that family interaction is crucial for some elderly and senior individuals in terms of maintaining cognitive function and general well-being. We are a social animal, for want of a better word. The challenge is you don't get something for nothing in medicine, whether it's public health or surgery. And the protection of those individuals in a long-term care facility relied on lockdown. What we did here in the seniors' homes was mirrored in other jurisdictions very rapidly when they realized how effective it had been. And I would draw everyone's attention to the fact we had only one case in a long-term care facility, and there's some debate around whether or not that was a false positive now, apparently. So it is a challenge, but unfortunately, we have lived through and are living through uncertainty. We make decisions with incomplete information, and we do that with goals in mind. If there is an ability to mitigate that somehow in terms of providing more company or doing things differently in a long-term care facility and yet maintaining that safety, should cases come back in numbers, then certainly we'd be open to any of the learnings from other jurisdictions.
Thank you.
Our next questions are from Meg Roberts of CBC News. Please go ahead.
I know we asked this last week, and Premier Fury, you kind of mentioned this a little bit, but I was just wanted to make it clear. Are there any update on plans for Christmas?
Well, I think the public health team and Dr. Fitzgerald's team is working diligently towards plans for Christmas. It's certainly top of mind for everybody, especially with loved ones and family away. There's no different that this is going to be a COVID Christmas. It's going to be a different Christmas than any of us have ever experienced. But as I mentioned, COVID time is difficult time, but it's also different time in trying to predict what the outcome will look like in 3 to 4 weeks. So I know that Dr. Fitzgerald's team is working diligently on it, but it will be difficult to fully predict with any degree of certainty until we're closer to. And I'll turn it to Dr. Fitzgerald, but I guess we're looking towards early November-ish to fully have a better appreciation with a degree of predictability surrounding the epidemiology for Christmas.
Yes, so I mean we have a Christmas squad in our team on our team right now, and they are looking at all the things related to Christmas. So we're looking at parties and New Year's and fireworks and all of those sorts of things that happen over the Christmas season, and considering other options as well with regard to a lot of requests that we've had with regard to visitation and visits and things like that, family visits and things. So we will certainly be, in the coming weeks, we will have that information out there, and we'll have more direction at that time. But as the Premier said, it is very difficult to predict this far out, unfortunately, because a week in COVID time is a year at any other time sometimes, right?
Sure, thank you. My last question is, what do you say to people who are concerned about the number of COVID cases in Alberta right now?
So, I mean, we're watching things very carefully, and but all of those personal public health measures that you can do will certainly help to reduce your risks. So, making sure you wash your hands carefully, practice physical distancing, wear a mask in public places where physical distancing especially can't be maintained. All of those things are really important. So for people who are in Alberta, who are coming home, if you can practice those public health measures, that will help to reduce your risk. And to stay in and only go out for essentials if you're in a place that's a hot spot, so to speak. But there are many places in Alberta that don't have a lot of cases, so we have to consider that there are some areas that have higher numbers than others, but it's still very important to maintain those personal public health measures.
Thank you very much.
Thank you, Dr. Fitzgerald. Being conscious of time, the House Assembly will be opening in a few minutes, but I just want to go through each reporter to see if you have any further questions. Kellyanne Roberts.
I just have one final one in regards to the flu. I know there's a lot of people out there who are hesitant about a vaccine. They think it actually makes you sick. Can you clear up these concerns?
three doctors here. I guess one of us could answer
The
that.
flu vaccine will not give you the flu. The flu vaccine is killed virus. It will not infect you. It will not give you the flu. A lot of people feel a bit achy, and they may, especially kids, may have a little bit of a fever after they have a flu shot. That is the normal immune response to the flu shot, to any vaccine. So those would be normal. Respiratory viruses circulate at the time of year that we give the flu shot, so lots of times people get sick after they get the flu shot because they have another virus of some type, but the flu shot itself will not give you the flu.
Thank you.
Richard Duggan, do you have any further questions?
No, I'm good. Thank you.
Peter Jackson.
Sorry. No, the lead of my story points out that you can't get flu from the flu shot
Do
today.
you have a further question?
Yes, I wanted to know whether the Christmas squad wear Santa hats.
What was that?
As long as they come with a mask.
Okay. All right. That's all. Thank you.
Meg Roberts, do you have a final question?
No, I'm good. Thank you very much.
Thank you very much for attending, folks. Premier, do you have any final remarks?
No, I'd just like to thank you all for the opportunity to speak once again to each and every one of you, and please reach out if you're feeling the stress of mental health of COVID-19. There is help available. You're not alone in this scenario. We recognize and appreciate that many of you are feeling heightened anxieties, but there are services available. So please reach out.
Thank you, Premier. Have a great evening, everyone.